Hi, I am delighted that you decided to join us for this amazing webinar where we'll go over the different hair loss treatments, red light therapy, and if they're right for you. Anyone with hair loss at all stages will benefit from this webinar, as will people on GLP-1 agonists for weight loss, because that's been linked to hair loss, as well as anyone on testosterone therapy or have a low thyroid, and anyone thinking about getting a hair transplant or has already had one. We'll review the common causes of hair loss and the different types and see if red light therapy really works. My name is Sam Walla. I'm a board certified family medicine physician and hair loss specialist in the Phoenix, Arizona area. And I also have a master's in molecular biotechnology, which makes me love the little molecular details of how these things work. I founded Him and Hair, which is both a clinic and an online telemedicine platform that serves patients in all 50 states. The story of hair loss begins in the hair follicle just beneath the scalp. You have two main areas. At the very bottom is where the blood supply gives nutrients and oxygen to the follicle to keep it alive and thriving. And you have a bulge closer to the surface where that second arrow is. That's where your stem cells are that regenerate new hair all of the time. The hair cycle goes through cycles. The two main ones you have to know about are anagen, which is the growth phase. Most of the hair you see on the scalp is in the anagen phase. It can last anywhere up to 6 years. And then it goes through a telogen phase where it's basically getting older and preparing to shed. Most of the follicles recycle back into the anagen phase, but sometimes they do not. And trying to tease out the causes is what we try to do best. The main types of hair loss are genetic or androgenetic alopecia for both that happens in both men and women. And you have other ones like telogen effluvium, alopecia areata, and scarring alopecia. And those are less common, but we'll address them briefly. The androgenetic alopecia, which is the main cause of most people's hair loss, is caused by genetics, and it's not just one gene and not simple like if your father had it, you're going to get it type of thing. It affects both men and women. In men, it's more at the temples and the crown. In women, it's more diffuse. And both are influenced by the level of DHT, which is called dihydrotestosterone. So your body makes testosterone, a portion of it gets converted to dihydrotestosterone, and this will cause a lot of hair loss because the follicles are very sensitive to it. For men, we use the Norwood scale to see where they're at in the process from stages 1 to 7. For women, we use the Ludwig scale to see where they're at in the process. And depending on that, we come up with a treatment plan. Now, just briefly about the other types of less common hair loss, telogen effluvium is when you have stressors like a hospitalization or weight loss or a sickness, and it causes a lot of hair to fall out at the same time. Luckily, most of this will regrow within a year. Alopecia areata is when your body attacks your hair follicles thinking they're foreign. And again, you need to do things that basically supercharge the immune system. And red light therapy is not a good fit for this type of hair loss. But in all types of hair loss, one common reason, other than the alopecia areata, is that the DHT levels are high in the scalp, the dihydrotestosterone, and that causes the follicles to basically get smaller and die. And so a lot of treatments focus on blocking the effect of DHT. Other reasons could be liver issues, kidney issues, iron deficiency. We always offer an extensive hair loss panel to our patients, which is completely optional, but many times most patients have already done these tests, and we go over it and try to figure out if there's a root cause that we can identify. The way to treat hair loss before we get to red light therapy is prescription, oral, and topicals. Red light therapy, and in the office, we do things like platelet-rich plasma, exosomes, stem cells, microneedling, and various hair products like shampoos, conditioners, and serums. Basically, minoxidil is oral and topical. It increases blood flow to the scalp, gets rid of waste and free radicals, and helps create a more vibrant environment for the follicle. Finasteride and dutasteride are topical and oral, and they work by blocking the conversion of testosterone to dihydrotestosterone. So, especially if you're on testosterone therapy, you have a higher rate of DHT. You want to block that in the scalp so you won't shed the hair. And there are other medicines like spironolactone and compounded topical formulations, which we make just for you. depending on what your needs are as a result of our telemedicine consult. All of the supplements out there either nourish the follicles or block DHT. They're not regulated by the FDA, so I like to help patients decide which ones are right for them. Hair care, we can use shampoos and conditioners that are paraben free, sulfate free. I recommend the Grow Well because it's already been vetted, but you're free to choose any shampoo conditioner that you like. Just make sure it's effective, and we can go over that in the consult as well. Dr. Kopelman makes a product line called Root MD, very effective hair serum, and basically put it on, wash it off after 5 minutes, and it helps block DHT naturally. In the office, we do a couple of things. Microneedling is where you use a pen with needles in it. It creates microchannels in the scalp that wake up the follicles, and we can introduce medications. We can draw your blood, spin it down, and that gold portion has a lot of growth factors in it. It's your own growth factors. We're re-injected in the scalp, and that helps the follicles be energized and wake up. Also, some clinics are doing exosomes and stem cells. We don't do these because the FDA has warnings on it, but basically stem cells can generate any tissue if depending on the environment that it's in. And when they go in the scalp, the idea is it makes more follicles and increases your hair counts. And finally, hair transplantation is basically when they take hair that's growing well on the sides and the back of your scalp and reimplant it in the areas of thinning. A lot of people do it here and in Turkey. And red light therapy, incidentally, has been shown to be very effective at preparing for a transplant and preserving it after it's done. So, what is red light therapy that we've been talking about? Basically, at a certain wavelength, 650 nanometers, the hair follicles are able to absorb those packets of energy, which is red light. The 650 is red light. And then it turns on the machinery and the factory to produce better, healthier hair. That's the idea of red light therapy, backed by years and decades of science. And what's confusing is there are a lot of devices out there. Some of them are knockoffs, some of them don't work. So I like to use ones that are evidence-based and have science behind them. They were first cleared by the FDA in 2007. There are over 29, 30 now, maybe devices out there, and it's been around for decades. I like to incorporate red light therapy in a medical hair restoration program. This is the light spectrum, and the visible light is between 400 and 760, and 650 nanometers is what you want your wavelength to be to have effective hair growth. Again, just to remind us of what the hair follicle looks like, and all this red light is going to target, the stem cells and the blood flow into the scalp to create a more healthy environment for hair growth. So let me show you an example of what we do and how we combine laser therapy with other treatments. And again, this is all not cookie cutter. It's dependent on you in our consultation to see what your needs are. But as a general rule, I like to use Grow Well because it's effective, backed by science, and very affordable compared to what's out there. So basically, in the Grow Well cap, there are 40 LED diodes and 20 low-level laser diodes. And they combine them in a special lens technology so that they deliver a highly effective energy, about 3 joules per centimeter square, making it one of the highest in the industry, actually, for full scalp coverage and effective hair growth. And they actually did peer-reviewed studies and in 2 different studies, and in 16 weeks, you get 35 to about 37% increase in hair density, which is amazing. So think what we can do if we can synergize the effect of the red light therapy on its own with proven medical treatments. So low-level laser therapy is effective as part of a complete hair restoration program. In very mild hair loss, it can be effective on its own. And Grow Well is a great system because it gives you maximum scalp coverage with the highest energy needed. And basically, you use it 25 minutes every other day. So our programs, just to give you an idea of how I incorporate it, okay, they're all customized solutions, 4-month programs, and 4 months, again, coincides with the 16 weeks we need to see good results. Our Amplify program takes the laser cap and combines it with oral medications. So basically, we're healing from the inside out. And We combine the two, and then we see where we're at in 4 months and decide how we're going to proceed. Our Fortify program combines laser therapy with topical solutions. Some people don't want to use pills at all, or they're not candidates for it. This aims to heal from the outside in, and also very effective and great results. The Restore program is our comprehensive program. It combines the laser cap as well as the oral pills, depending which medication is right for you, and the topical, depending which topical is right for you, to give you the best chance at hair restoration. No one else does this level of personalized customization for the patient. Most companies are cookie cutter. After your 4 month program, you already have the cap. You choose to continue either with the cap alone or with the medication or with the medication and topical or the topical alone. And basically, the maintenance programs where if you just wanted the medication alone would be the core. If you wanted the topical alone, it would be the precision. And if you wanted the ultimate, which combines the topical and the oral, that would be the program for you. Some people that just need the cap by itself, our accelerator program, we give it at a huge discount to our patients. And overall, no matter what program is right for you, you get a comprehensive, complete access to the program itself, recommendations for supplements, prescription topicals, shampoos, conditioners, serums, any labs you need, and you get monthly follow-ups at no extra charge with your actual physician. So this is just a schematic to show you. Amplify includes the cap and meds, Fortify the cap and the topicals, Restore the cap, the meds, and the topicals. And the others are our maintenance programs. So all you got to do now, just book your free consult, go to himandhair.com. If you're interested in any financing options, we offer 0% with a very soft credit check. Doesn't hurt your credit report. It's through Care Credit. And unlike the other companies which make you pay for the branding, we give you those same medications that are FDA approved and generic, but we offer it to you in a way that's affordable because we don't make any money off the medication. We try to give you a program that works. And all the other companies, you'll be paying a lot of money and they don't even offer the benefit of red light laser therapy like we do. So I'm very, very happy with my partnership with GrowWell because they made it easy, accessible, and affordable for patients interested in hair loss for both men and women. So again, if you follow our program and you're not happy at any time, we encourage you to try it for up to 12 months. But at any time you're not happy, just return the cap for a full refund. No questions asked, no restocking fee, just you get the money you paid back. And usually that's the price of the cap. Of course, the price of the medications we can't refund. Again, these are examples of hair growth that we've seen with our programs, and we are excited that you might be close to starting your own red light therapy transformation. We have no obligations, and we're the fraction of a cost of what's out there. Just click for a telemedicine consult, pay nothing. Let's talk about your options and go from there. Thank you so much for your time, and I know I rushed through a lot, and hopefully we'll be able to go through more detail in our consult. Thank you, and have a nice day.